Good day, students. I welcome you to another interesting study session of PHA 301, which will discuss the problems of drug therapy. In the previous study sessions, we have been able to discuss the pharmacokinetics and pharmacodynamic concepts of pharmacology. Now we want to discuss the problems of drug therapy. What are the likely problems one can encounter during drug therapy? A common problem physicians face is the risk of patients building a tolerance to the drugs taken, like morphine, which is used to control pain, which leads to the patient's body requiring higher doses for the drug to be effective, which can lead to drug overdoses. Additionally, many side effects of drug inhibit the body from absorbing necessary nutrients. At the end of this study session, you should be able to discuss the concept of drug therapy problem to include its components. You should be able to explain patients' need for drug therapy and describe drug-related problems in the elderly. Drug therapy problem. Drug therapy problems, which is abbreviated as DTP, is an undesirable event experienced by the patient, which involves or is suspected to involve drug therapy and that interferes with achieving the desired goals of therapy and requires professional judgment to resolve. The purpose of identifying drug therapy problem is to help patients achieve their goals of therapy and realize the best possible outcomes from drug therapy. If not resolved, drug therapy problems have clinical consequences. As clinical patient problems, drug therapy problems require professional judgment to resolve. The characteristics of requiring professional judgment place drug therapy problems at par with other clinical problems in medicine, dentistry, and nursing. What are the categories of drug therapy problems? 1. The drug therapy is unnecessary because the patient does not have a clinical indication at this time. We can also have the problem of additional drug therapy, which is required to treat or prevent a medical condition in the patient. There could be a problem of drug not being effective. That is, the drug product is not being effective at producing the desired response in the patient. Dosage too low. The dosage is too low to produce the desired response in the patient. Also, adverse reactions. When the drug is causing an adverse reaction in the patient, it can be dosage too high, resulting in undesirable effects experienced by the patient, and it can be not able to or willing to take the drug therapy as intended. The identification of drug therapy problems is the focus of the assessment and represents the key decisions made in that step of the patient care process. Although drug therapy problem identification is technically part of the assessment process, and as we all know, it is a duty of a nurse to assess your clients. It represents the truly unique contribution made by pharmaceutical care practitioners and nurses. Drug therapy problems should be assessed for their severity, acuteness, and significance to the patient to determine how quickly the resolution of the problem must occur. When multiple drug therapy problems exist, you prioritize them and begin with the problem that is most important to the patient or that is critical to the health of the patient. Patients who have no drug therapy problems still require a care of plan and follow-up evaluation to ensure that the goals of therapy continue to be met and no new drug therapy problems develop. What are patient needs for drug therapy? 5 patient needs for drug therapy has been identified. 1. Every drug has an appropriate indication. Then drug therapy is effective. Drug therapy is safe. Patients can comply with drug therapy. Then, last but not the least, no untreated indications are present. What are the drug-related problems that can be found in elderly? Drugs may be ineffective in the elderly because clinicians underprescribe. For example, because of increased concerns about adverse effects, or because adherence is poor, which can be as a result of financial or cognitive limitations. You can have adverse drug effects, which are effects that are unwanted, uncomfortable, or dangerous. Common examples are oversedation, confusion, hallucinations, falls, and bleeding. Adverse drug effects can occur in any patient, but certain characteristics of the elderly make them more susceptible to this effect of drug therapy. For example, the elderly often take many drugs, which is polypharmacy, and they have age-related changes in pharmacodynamics and pharmacokinetics. Both increase the risk of adverse effects. At any age, adverse drug effects may occur when drugs are prescribed and taken appropriately. For example, new onset allergic reactions are not predictable or preventable. However, adverse effects are thought to be preventable in almost 90% of cases in the elderly, compared with only about 24% in younger patients. What are drug-disease interactions? Sometimes when you're on medication, you think, is it the medication I'm taking that is making me to feel sick? And another thought would be like, is it the symptoms of the disease? A drug given to treat one disease can exacerbate another disease regardless of the patient's age. But such interactions are of special concern in the elderly. To distinguish adverse drug effects from the effects of the disease is difficult and may lead to a prescribing cascade. A prescribing cascade occurs when the adverse effect of the drug is misinterpreted as a symptom or sign of a new disorder, and a new drug is prescribed to treat it. The new unnecessary drug may cause additional adverse effects, which may then be misinterpreted as yet another disorder and treated unnecessarily, and so on. Many drugs effects that resemble symptoms of disorders common among the elderly or changes due to aging. We have inadequate monitoring. Monitoring drug use involves documenting the indication for a new drug, keeping a current list of drugs used by the patient in medical records, monitoring for achievement of therapeutic goals and other responses to new drugs, monitoring necessary laboratory tests for efficacy or adverse effects, then periodically reviewing drugs for continued need. Lack of close monitoring, especially after new drugs are prescribed, increases the risk of adverse effects and ineffectiveness. We can have inappropriate drug selection, which can be in form of duplication, drug interaction, drug mistakenly continued, and the choice of the drug. A drug is inappropriate if its potential for harm is greater than its potential for benefit. Inappropriate use of a drug may involve the choice of an unstable drug, dose, frequency, or dosing or duration of the therapy. Then you can have duplication of therapy, failure to consider drug interactions and correct indications for a drug, appropriate drugs that are mistakenly continued once an acute condition resolves, as may happen when patients move from one healthcare to another. Some inappropriate drugs are available OTCs, that is over-the-counter drugs. Thus, clinicians should specifically question patients about the use of over-the-counter drugs and tell patients about the potential problems such drugs can cause. The elderly are often given drugs, typically analgesics, histamine receptor blockers, the hypnotics or laxatives for minor symptoms that include adverse effects of other drugs that may be better treated non-pharmacologically or by lowering the dose of the drug that is causing the adverse effect. Initiating additional drug is often inappropriate. Benefits may be low, costs are increased, and a new drug may lead to additional toxicity. There could be lack of patient adherence, and some factors contribute to this. Financial and physical constraints, which may make purchasing these drugs difficult. There could be cognitive problems, which may make taking drugs as instructed difficult. We can have use of multiple drugs, as in polypharmacy. We can have use of drugs that must be taken several times a day in a specific manner, which makes patients difficult to adhere to this kind of treatment. There could be lack of understanding about what a drug is intended to do, that is the benefit of the drug, and how to recognize and manage the adverse effects. Pharmacists and nurses can help by providing education and reviewing prescription instructions with elderly patients at each encounter. Pharmacists may be able to identify a problem by noting whether patients obtain refills on schedule or whether a prescription seems illogical or incorrect. Thanks for listening. Have a good day.